Welcome to the second installment of our three-part series featuring Women's Health Medical Advisor Dr. Maura Quinlan and our guest Erica Austin. In this episode, we will be exploring how Erica determined her treatment options. Take a listen here.
Okay, Erica, thank you so much for taking time to talk with us today. I'm Maura Quinlan. I'm an OBGYN in Chicago and also the Women's Health Medical Advisor for IDPH. And I'll let you introduce yourself and then we'll go through some questions.
Okay, I'm Erica Austin. I am Deputy Director at SIU School of Medicine in the Office of External Relations and Behavioral Health Workforce Center. I also serve on the Springfield School Board. I serve many different hats in capacity within the Springfield community, and I was diagnosed with breast cancer this year in June.
Wow, that's so many things all juggling like so many women do. So we wanted to talk about your treatment. Can you tell us about the diagnosis and what treatment what you were offered and what you decided to do?
Okay, so going in, I had an appointment with the breast cancer plastic surgeon, and I had already done my research, so I knew I wanted a lumpectomy because of my age, and I just didn't feel comfortable with getting a mastectomy right now. So I knew I wanted a lumpectomy. But then the doctor asked me, what about having a breast reduction, which is also a preventative measure, and we can use that as a middle ground. And so I really didn't hesitate. I was like, yes, let's do it for the first options. And I say that to say 7 out of 10 people do not know that they have that breast reconstruction is an option for them when they're diagnosed, but it certainly is. If this ever happens to you, just know that that is an option for you. It is covered by your insurance. They will cover that. And just to know all your options, do your research on your options.
So you had that discussion before you had any procedure, and so you chose to have surgery, the breast cancer lumpectomy from that side and a reduction
On both
sides.
Yes.
So you could have chosen, they gave you all those options to go instead of 2 surgeries, you had it just all at one time.
I had all at one time.
And what's the recovery like?
I am currently in radiation, so I have to do 20 sessions of radiation. So I go Monday through Friday, so every day, except the weekends, to get radiation. Radiation is actually very, very quick. It's like less than 10 minutes when you go in. The original plan was for me just to get radiation, but when you have surgery, breast cancer surgery, they take a piece of the cancer, they send it off to a lab, then the lab sends it back and they score it based off, like, I guess, a national chart. Well, my labs came back a little higher than what they expected. And so this is where technology comes in, and we have to appreciate technology and clinical research. Because of clinical research and technology, I was able to take injections instead of chemotherapy, because had that not been there, my next option would have been chemotherapy. But now I'm taking injections once a month for 5 years, and I have to take a pill every day for 5 years. And so yeah, that's my process of recovery has been radiation every day. I had my first injection, but I have not started the pills yet. But that's my plan.
That's for the 5 years. What does radiation feel like after? Does it hurt at the time, or any symptoms you feel after it's over, that later that day?
They're very fatigued, very fatigued. I call myself the Energizer Bunny because I do so much, but I have to pull back because my body is still in recovery from surgery, number one, but also added to radiation, I'm also often very tired, just very tired.
Yeah, understandable. We were talking before this started about social media and how sharing your story, how you've done that and how helpful that might have been.
I have shared my story through social media platforms, and I actually had the opportunity to go to New York Fashion Week to model for a designer named Dana. And so she has a line called Anna Ono, and her line is to make women feel beautiful. So she has a line for breast cancer survivors and patients because herself, she's a breast cancer survivor. And so she makes lingerie for women to be proud of who they are, even in this diagnosis. And so I had the opportunity, sponsored by SIU School of Medicine, to go to New York and to model in New York Fashion Week. And so that has been like my platform ever since that. I've been advocating, telling people to go get mammograms, go get checked out. and even educating them about breast cancer awareness, breast cancer reconstruction.
Yeah.
So, yes, my platform is just to go because early detection does save lives.
Yeah. And to celebrate your body and be on the runway right around diagnosis is very powerful.
Thank you for tuning in to this enlightening conversation between Dr. Quinlan and Erica Austin. Don't miss out on part 3, where Erica speaks candidly about her survivorship. If you or someone you know is in need of mammograms, breast exams, or Pap tests, contact the Women's Health Line at 888-522-1282. Some individuals may be eligible for free testing. Again, that's 888-522-1282.